I am Dr. Ram Narayan, Senior Consultant Restorative Neurosurgeon. What is this restorative neurosurgery? This is a new branch of neurosurgery which involves surgical management of lost nervous functions. Nervous functions get lost due to various conditions like Parkinson's disease, like stroke, paralysis, so many conditions. So nowadays, by surgical methods, we can restore this lost nervous functions. As we all know, conditions like stroke, conditions like incontinence, conditions like even addiction, all these have a lot of not only medical problems but also a lot of social connotations. A lot of lives get lost because of this, a lot of financial problems happen. So by surgery, especially in those resistant cases where no other treatment is possible, by surgical methods we can help these patients get back to a normal life. To be able to pass urine when you want is sometimes a very, very pleasurable feeling. But I am sure all of us have faced a situation when we cannot pass urine when we want, or by some reasons we are not able to control our urine, so that people are forced to wear diapers or on catheter tubes and all that. It's a very depressing situation. When people are not able to control their urine, when the urine flows out without control, it's called incontinence. Whereas when people are not able to pass the urine when they want, it is called retention. The urinary bladder is a muscular structure which accumulates urine, and at a particular phase it empties the urine out into the open. And this is how it works, and this is controlled by the brain and the nervous system. If by any chance there is no control of the brain onto the urinary bladder, either the bladder does not control when the urine fills up, or the bladder continuously keeps draining out, dribbling out the urine. So this condition is called neurogenic bladder. This is one cause for people not able to control their urine. Of course, there are other causes which are more of urological causes. I am not going into that now. Neurogenic bladder usually is caused due to various diseases including Parkinson's disease, spinal cord injury, multiple sclerosis, so many neurological conditions which affect the urinary bladder. So many conditions, diabetes, so many conditions are there. Here what happens is the nerves to the bladder are affected, so that the control system from the brain cannot give the messages to the bladder to either contract or hold on. This is a problem. So how do you treat this? There are various ways of treating it. Of course, the commonest obviously is by medicines. There are some good medicines which can control the bladder, which can control the sphincters. That is, sphincters are muscles which guard out, which are the guardians actually. They guard outside, so that even when we cough or something like that, urine does not come out. So you can improve the quality of the sphincter muscle, or you can improve the quality of the bladder muscles by medical management. In some people, this is not possible. So another very common technique which is used by urologists is by what is called self-catheterization. That is, you put catheter whenever you want to pass urine, or the catheter is put full time or 24 hours, 7 days a week. Both of these can cause problems like multiple infections, and ultimately ends up in damage to the bladder as well as even to the kidneys. So this is not a good idea, because multiple infection, you can't get infections every day, every week and all that. It's not possible. So how do you take care of these issues? As I said earlier, the nerves are controlling the urinary bladder, and these nerves are called sacral nerves, S2, S3, S4. What we do is, we can by electrical stimulation, we can control these nerves to control the bladder. Thank you very much.